Now there is further evidence of the spread of hantavirus on board a cruise ship after a French passenger tested positive for the disease while being repatriated. Her condition is said to be deteriorating.
There is a virus that between the time you breathe it in and the time you know you are in trouble, gives you what feels like the flu. And then it gives you about 4 to 10 days. That is the number I want you to register before anything else in this video. 4 to 10 days from the point your body says you have something, to the point your lungs may be in real difficulty. Hantavirus pulmonary syndrome. The case fatality rate is roughly 38%. Not 38 in 100 who get a bad cough. 38 in 100 who reach severe respiratory symptoms. That number has not meaningfully moved in 3 decades. I want to be careful with how I phrase this, because hantavirus is rare. Since the United States began counting in 1993, the country has accumulated fewer than 900 documented cases. So the absolute risk to a 65-year-old in the suburbs is not enormous. But it is the asymmetry of this illness that has my attention. Low frequency, very high consequence, easy prevention, and a symptom timeline that is almost designed to be misread. That is the combination I want to walk you through. A standard reminder before going further. This is educational. I am not your physician. Anything that matters about your specific situation passes through someone who knows your case. If you have a respiratory condition already, or if you are caring for someone who does, treat what follows as a conversation starter with your doctor, not a replacement. In February of last year, in a house in Santa Fe, New Mexico, a 65-year-old classical pianist named Betsy Arakawa died alone of hantavirus pulmonary syndrome. Her husband was the actor Gene Hackman, 95 years old, who had advanced Alzheimer's disease. The medical examiner in Santa Fe later determined that Mrs. Arakawa died around February 12th. Mr. Hackman, who almost certainly could not have understood what was happening, survived her by about a week. Both of them were found together on February 26th, when neighbors raised concern. The New Mexico Department of Health later confirmed she was the first hantavirus death of 2025 in the state. What happened to Betsy Arakawa is the entire shape of why I want you watching the next 20 minutes. She lived in a region with rural mice. The home almost certainly had quiet rodent activity in a storage area, a shed, or somewhere out of view. She came down with something that felt like the flu. There is no public evidence that she sought care during those early days. By the time the symptoms became severe, the window was probably already closing. One single exposure to dust from rodent droppings, breathed in while doing something completely ordinary, is enough. I want to sit with that case for a moment longer, because the details are instructive. Santa Fe sits at about 7,000 feet of elevation in the high desert of northern New Mexico. The surrounding pinyon juniper landscape is prime deer mouse habitat. The mice spend the cooler months looking for places to nest. Outbuildings, wood piles, garages with cracked weather stripping, the gap behind the clothes dryer. The Hackman Arakawa property included multiple outbuildings, and the medical examiner's preliminary statements indicated that evidence of rodent activity was noted on the premises. None of this was unusual for a rural property in northern New Mexico. The state's health department later confirmed that hantavirus was actively circulating in deer mouse populations across the region during that winter, which is consistent with their annual surveillance for the previous 20 years. There was no outbreak. There was a single woman, in a single household, doing something completely routine, likely cleaning a closed space, who inhaled the wrong dust on the wrong day. That is the entire profile. And then, this spring, something else happened that has the field paying attention. In April of 2026, a Dutch expedition cruise ship called the MV Hondius left Ushuaia in Argentina with passengers heading toward the South Atlantic and Antarctica. By mid-April, a passenger was dead. His wife disembarked, was hospitalized in Johannesburg, and died 2 days later. By the time the World Health Organization confirmed the strain on May 7th of this year, it was the Andes virus, which is the one hantavirus on record that has been documented to pass person to person in close, prolonged contact. By May 11th, the European Center for Disease Prevention and Control was reporting 9 cases, 7 confirmed, 2 probable, and 3 deaths from that single cluster. 17 American passengers came back into the United States on a containment protocol. The CDC has said publicly that the risk to the broader American public remains extremely low. I agree with that statement, but I also think the timing of 2 high-profile hantavirus events inside 14 months, a documented domestic death and a multi-country cluster, is the right moment to walk through what this illness actually looks like, where it lives, and the simple things that prevent it. I do not see patients, I read papers. The literature on hantavirus is dense and unusually clear because the case counts are small enough that almost every documented infection has been studied. So what I am about to walk you through is not speculation. It is the synthesis of CDC clinical briefs, the New England Journal of Medicine case literature, the WHO situation reports on the 2026 cluster, and the regional health department write-ups from New Mexico, Arizona, Colorado, and Washington State, where the bulk of American cases occur. Let me name what we are talking about. In the United States, the strain that does the killing is called sin nombre virus, Spanish for without a name, because when researchers identified it in 1993 after the Four Corners outbreak, there was no existing name for it. The 1993 outbreak, for context, is one of the more remarkable detective stories in modern American infectious disease. A cluster of previously healthy young adults in the Four Corners region, where New Mexico, Arizona, Colorado, and Utah meet, began arriving at hospitals with severe respiratory distress. Several died within days. CDC investigators, working with the Indian Health Service and state health departments, traced the cases backward, ruled out every known pathogen, and within months had identified a brand new virus carried by the deer mouse. The lead investigators at the time said publicly that they had not expected to find an entirely new hantavirus circulating in North America. The discovery rewrote the textbooks. Since 1993, every American hantavirus case has been traceable to a small family of related viruses circulating in different rodent species across the continent. Sin nombre lives in the deer mouse, Peromyscus maniculatus, a small rodent, brown on top, white on the underbelly, two-tone tail, found across most of the rural western United States. The deer mouse does not get sick from carrying the virus, it just sheds it, in its urine, in its droppings, in its saliva, in nesting material. The virus survives in dry dust for a period the literature still debates, but the operational answer is long enough to matter when you sweep. Here is the mechanism in plain terms. The virus is not transmitted by a bite. It is not respiratory in the way a flu is. You do not catch it standing next to someone with a cough. The route is something called aerosolization. A mouse has been in a shed, or a cabin, or the back corner of a garage for weeks. It leaves droppings. The droppings dry. Someone goes in, opens the door, picks up a broom and sweeps. Or runs a vacuum, or kicks up a pile of insulation. The dry particulate that contains the virus gets airborne. You breathe it. Inhalation is the dominant route of transmission. Skin contact is much rarer. Eating contaminated food is rarer still. The number one way Americans get hantavirus is by stirring up dust in a closed space that had mice in it. The cellular biology of what happens after inhalation is worth a moment, because understanding it changes how seriously you take the cleanup protocol. Once a virus particle reaches the small airways of the lungs, it does not infect the airway lining cells the way an influenza virus does. It travels deeper. The hantavirus has an affinity for the cells lining the smallest blood vessels in the lung, the pulmonary capillary endothelium. Those cells are the structural barrier between your circulating blood and the airspace of your lungs. They are normally so tight that almost nothing crosses without permission. When hantavirus infects them, the virus does not kill the cell outright. Instead, it disrupts the cell-to-cell junctions that hold the barrier together. Plasma, the watery component of blood, begins to seep across the barrier into the air spaces. The lungs literally flood from the inside. This is why hantavirus pulmonary syndrome looks like sudden severe pneumonia, or ARDS, on imaging, even though the underlying mechanism is closer to a leak than to an infection of the lung tissue itself. Understanding the leak model also explains why aggressive intravenous fluid resuscitation, the standard reflex in a hypotensive patient, can make hantavirus dramatically worse. More fluid means more pressure across an already leaking barrier. The clinical management is counterintuitive for that reason. I want to give you the timeline now, because the timeline is the entire reason this video exists. After exposure, you feel nothing. The incubation period, according to the CDC clinical brief on hantavirus pulmonary syndrome, runs anywhere from 1 to 8 weeks. Most cases develop within 2 to 4 weeks. So if you cleaned out a cabin in the second week of June, the first symptom might land in late June, or it might land in the second week of July. This delay is one reason hantavirus is hard to diagnose. Patients show up at urgent care saying, "I have the flu," and they cannot connect today's symptom to a cleanup they did 3 weeks ago. The first phase is called the prodrome. It looks exactly like influenza: fever, fatigue, headache, muscle aches, and the CDC clinical brief is specific that the muscle aches concentrate in the large muscle groups: thighs, hips, back, shoulders. Some patients also report nausea, vomiting, and diarrhea. There is sometimes a dry cough. There is usually not, at this stage, significant shortness of breath. This phase lasts somewhere between 3 and 6 days for most patients. It is indistinguishable from a moderate flu in almost every respect. And then the second phase begins. The CDC literature calls this the cardiopulmonary phase. 4 to 10 days after the prodrome started, in patients who progress to severe disease, the lungs begin to fill with fluid. Not from infection of the lung tissue in the way pneumonia presents. The virus damages the cells lining the small blood vessels in the lung, the capillary endothelium, and those vessels begin to leak. Plasma moves from the bloodstream into the air spaces of the lungs. The patient starts to feel short of breath. The cough deepens. Heart rate climbs. Blood pressure can drop. Within a day or two, some patients require mechanical ventilation. In the worst cases, the heart muscle itself becomes involved and pumps less effectively. This is where the 38% fatality rate comes from. It is a fast, dangerous deterioration, and the only thing that meaningfully improves outcomes is being in an intensive care setting when the lungs begin to fail. Here is the practical translation. Almost everyone with the prodrome who ends up dying did not go to the hospital during the prodrome. They went when the breathing got bad. By that point, the window for advanced supportive care has narrowed. So if you have done any rodent-adjacent cleanup in the past 1 to 8 weeks, and you develop a flu-like illness with deep muscle aches in the thighs and hips, the right thing, the only right thing, is to tell the urgent care physician or the emergency room physician that exposure history within the first day or two of symptoms, not on day 5. The phrase you want them to hear is, "I may have been exposed to rodent droppings approximately X weeks ago." That sentence puts hantavirus on the differential before the lungs start to fill. I want to plant something here and come back to it. There is no specific antiviral treatment for hantavirus pulmonary syndrome. What works is early recognition and early intensive supportive care. Oxygen, ventilation if needed, fluid management, sometimes ECMO in advanced centers. The literature on this is unambiguous. The window matters more than any single intervention. Hold that thought. We will return to it after the prevention section. Let me give you the population picture. The CDC surveillance data through 2023 records 890 hantavirus cases in the United States since 1993. Roughly 2/3 occur in the 4-state region commonly called the Four Corners: New Mexico, Arizona, Colorado, Utah. Washington State, California, and Texas also see regular case counts. The states with the lowest documented exposure are dense urban states in the Northeast, but cases do appear there occasionally when people travel west, do rural property work, and return. The demographic that gets hantavirus is almost never what you would predict from watching the news. The classic case profile in the American literature is not a young hiker who got bitten in the wilderness. It is somebody in their 40s through 70s, often male but often not, who did a cleaning task on a structure that had been closed up for the season. A hunting cabin opened in October. A second home checked on after a winter. A barn cleaned out in spring. a trailer pulled out of long-term storage, a shed in the backyard that had not been disturbed since last summer. The structure is the variable. The species of the mouse is the variable. The cleaning method is the variable. The patient is almost incidental. Betsy Arakawa was 65. She lived in a state with significant deer mouse populations. Her home, by reports, had outbuildings consistent with rural Santa Fe. None of that made her unusual. What made her unusual was that the timing of her death meant she likely died without realizing what was happening to her, in a household where the only other person present could not call for help. The asymmetry of the illness, invisible mouse, invisible droppings, invisible inhalation, 3-week silent incubation, flu-like deception, then a fast closing window, is what gets people. Now let me give you the prevention section. This is the part of the video that if you watch nothing else, watch this. Most American hantavirus exposures could have been prevented with 3 changes to how the cleaning was done. The CDC has published these as standing recommendations for over 20 years, and they have not changed because they keep working. First, do not dry sweep and do not vacuum. This is the single most important behavioral change. Sweeping a dry surface contaminated with rodent droppings is the most efficient mechanism for aerosolizing the virus that we know of. Vacuuming is almost as bad, because most household vacuums exhaust fine particulate back into the room. If you find evidence of mice in a closed space, droppings, nesting material, the smell, the broom and the vacuum stay in the closet. Second, ventilate first. Open the doors, open the windows, leave for at least 30 minutes. The CDC recommends a full hour of cross-ventilation before entering a structure that has been closed up with potential rodent activity. This is uncomfortable advice because it means you cannot do the cleanup the same hour you discover the problem. You arrive at the cabin, you see droppings, you open everything and you leave. Drive into town, have lunch, come back. The hour matters. Third, wet the area with disinfectant before any cleaning. The CDC recipe is a 10% bleach solution. 1 part standard household bleach to 9 parts water. Mix it in a spray bottle. Spray every visible droppings area until it is wet. Let it sit for at least 15 minutes. Then wipe up with disposable paper towels and dispose of the towels in a sealed bag. The bleach denatures the virus. The wet wiping prevents aerosolization. Spray, wait, wipe. Spray, wait, wipe. That is the entire protocol. For heavy contamination, and this is the threshold the CDC defines as roughly enough droppings to fill a small handful, or a clear nest, or rodent carcasses, the recommendation rises to an N95 respirator or better, ideally a half-mask air-purifying respirator with high-efficiency particulate filters, plus impermeable gloves, plus goggles without ventilation holes. This is not optional protective gear for a heavy infestation. It is the protocol. Let me give you the everyday version. If you have a cabin, a shed, a barn, a garage, a basement, a crawl space, a trailer, or a second home that has been closed for more than 2 weeks, treat opening it like a small biosafety operation. Walk up, open everything, walk away. Come back in an hour. Spray a 10% bleach solution on any droppings or nests. Wait 15 minutes. Wipe with paper towels into a sealed bag. Wash your hands carefully when you are done. That sequence, ventilate, spray, wait, wipe, turns a high-risk situation into an essentially zero-risk one. There is a documented case in the public health literature that I want to walk through briefly because it illustrates how mundane the exposure can be. A man in his early 60s in rural Washington state, call him D from the published case write-up, opened his late father's storage shed in spring after the property had been vacant through winter. He spent about 45 minutes inside, moving boxes, sweeping the floor with a household broom, and emptying out a small pile of insulation that mice had clearly nested in over the cold months. He wore no mask. He did not ventilate the space beforehand. The dust was visible in the slanted light from the open door. He felt fine that day. He felt fine for the next 18 days. On day 19, He developed what he described to his wife as a moderate flu: fever, body aches concentrated in the thighs, exhaustion. He took over-the-counter medication and stayed in bed for 3 days. On the 4th day of symptoms, he could not catch his breath climbing the stairs. His wife drove him to the emergency room. The chest X-ray showed bilateral infiltrates. The complete blood count showed the classic pattern: low platelets, a left-shifted white count, atypical lymphocytes. The exposure history of "I cleaned out my father's shed 3 weeks ago" put hantavirus on the top of the differential. He was on a ventilator within 12 hours of arrival. He survived. The published account notes that his survival was almost certainly attributable to his wife knowing to mention the shed cleanup the moment they walked into triage. Without that detail, the workup might have spent another 12 hours chasing bacterial pneumonia or influenza, and the outcome could easily have been different. A separate behavioral note. Rodents enter through openings smaller than most people imagine. A deer mouse can pass through a gap about 1/4 of an inch wide, roughly the width of a pencil eraser. The CDC's prevention guidance emphasizes sealing gaps around pipe penetrations, foundation cracks, dryer vents, attic vents, gable vents, and the gap under garage doors. Steel wool stuffed into a gap and sealed with caulk is the standard low-cost solution. Traps inside and around the structure decrease the resident population. The combination of exclusion plus trapping reduces droppings load over time more reliably than any cleaning protocol can. Let me return to the early warning detection that this video is structured around. If you have done rodent-adjacent cleanup in the previous 1 to 8 weeks, write that date down. Pin it to the refrigerator if you have to. The reason is that if you develop a flu-like illness inside that window, the timing matters, and it matters in the first day of symptoms, not the 5th. Here is the self-check. I want you to read this slowly. Onset within 1 to 8 weeks of any cleanup of an enclosed space. Yes or no? Fever above 101. Yes or no? Deep aching in the thigh, hip, lower back, or shoulder muscles, beyond what a normal flu produces. Yes or no? Profound fatigue, the kind where lying down is the only available position. Yes or no? Headache that is not relieved by typical over-the-counter analgesics. Yes or no? Nausea, vomiting, or diarrhea. Yes or no? If you have 3 or more of these and any rodent exposure in the previous 8 weeks, the conversation with a clinician is not, "Do I have the flu?" The conversation is, "I had rodent dust exposure approximately X weeks ago, and I am presenting with the following symptoms. Please consider hantavirus pulmonary syndrome in the differential." That sentence is the most important thing in this video. What changes when a physician hears that sentence is the speed of the workup. Hantavirus is diagnosed primarily through serology, a blood test for antibodies, combined with the clinical picture. Some centers can also run PCR for the virus directly. A complete blood count in a hantavirus prodrome often shows specific abnormalities: a left-shifted white count, low platelets, the appearance of atypical lymphocytes called immunoblasts in the peripheral smear. A chest X-ray in the prodrome phase is often normal. A chest X-ray, once the cardiopulmonary phase begins, shows rapidly progressive bilateral infiltrates that the on-call radiologist will read as pulmonary edema or ARDS. The reason early recognition matters so much is that the second phase moves fast. Patients can go from "I should get a chest X-ray" to "I need ICU admission" inside 12 to 24 hours. Hospitals that recognize hantavirus early can move the patient to intensive monitoring before the lungs begin to leak. Fluid management is critical because giving too much intravenous fluid in a patient with leaky pulmonary capillaries makes the syndrome worse. Some advanced centers have used extracorporeal membrane oxygenation, ECMO, to support patients through the worst 48 hours of cardiopulmonary collapse, with case reports of full recovery. None of that is available to a patient whose hantavirus is diagnosed for the first time after admission to a community hospital with severe shortness of breath. I want to address the 2026 cruise ship cluster briefly because it is the one component of this story that is genuinely unusual, and the popular press is not handling it well. The MV Hondius was a Dutch expedition vessel that departed Ushuaia in early April and traveled to remote subantarctic locations, including South Georgia, Tristan da Cunha, St. Helena, and Ascension Island. The virus identified was Andes virus, not sin nombre. Andes virus is the South American hantavirus, carried by a different rodent, the long-tailed pygmy rice rat, and it has one characteristic that no other hantavirus has reliably demonstrated. It can spread, in rare cases, from one person to another during close, prolonged contact. That is why the WHO and the CDC have emphasized monitoring of close contacts of confirmed cases. As of the May 8th CDC hand notice and the May 11th ECDC update, the cluster has 8 to 9 cases and 3 deaths across passengers and crew from many countries. 17 Americans returned to the United States under public health observation. No secondary cases have been reported domestically. The CDC has stated explicitly that risk to the American public from this cluster is extremely low. The CDC's hand notice of May 8th specifically advised American clinicians to consider Andes virus in any patient presenting with compatible respiratory symptoms within 42 days of cruise travel to South America or subantarctic regions. That 42-day window matters because it lines up with the maximum documented incubation period for Andes virus, which is slightly longer than the sin nombre incubation window. American emergency departments and primary care offices have been alerted to ask about cruise travel history in any patient presenting with a flu-like illness over the past 6 weeks. That is the right level of public health response. It is also not a reason for a viewer who has not been on an expedition cruise in the South Atlantic in the last 2 months to worry about Andes virus. What that cluster does not mean is that hantavirus is becoming a respiratory pandemic in the way that COVID-19 was. The Andes virus has been observed in person-to-person transmission only in tight, prolonged, close contact settings, typically within the same household. And even there, the secondary attack rate is low. This is not influenza-like spread. It is not respiratory droplet contagion in a meaningful public health sense. What the cluster does suggest is that adventure travel itineraries that involve close sleeping quarters in remote regions where Andes virus is endemic deserve a different risk conversation than a standard cruise. That is a niche concern. It applies to a handful of high-end expedition cruises a year. What the cluster also reminds the rest of us is that hantavirus, when it shows up in a contained population, becomes a major event quickly. 8 cases, 3 deaths, a multinational evacuation, international health agencies mobilized across 6 countries. That is what a small number of severe cases looks like when concentrated in time and space. I want to address one more practical issue that I get asked about whenever this topic comes up. What about pets, gardens, bird feeders, and the small daily encounters with the natural world that rural and suburban Americans live around? The honest answer is that ordinary outdoor encounters with rodents, a mouse running across the patio at dusk, droppings on the back porch, are not the high-risk scenario. The risk is dust in enclosed spaces. Open air dilutes the virus. Sunlight degrades it. The handful of droppings on an outdoor deck that gets rained on does not produce the kind of aerosol load that drives infection. What does produce that load is a closed structure with weeks or months of accumulated nesting material, dry indoor air, and someone in the middle of it disturbing the surface. Bird feeders are worth a small mention. Spilled birdseed under and around feeders attracts mice in significant numbers. Many wildlife and public health groups now recommend either elevating the feeder on a baffled pole, sweeping spilled seed daily into a sealed bag, or accepting that the feeder is going to function as a rodent attractant. If you keep a feeder within 20 feet of your house, you are running a small, ongoing experiment in how close you want the deer mouse population to your foundation. That is not necessarily a problem. It is a variable to know about. Pets are a more interesting question. House cats that catch mice are doing real population control, but they can also bring partially eaten rodents into the house, which is its own contamination source. Dogs are generally not at meaningful risk from hantavirus themselves. They are not the target species, but they can disturb nests outdoors and carry contaminated material on their fur into the house. The practical guidance is the same as for any rodent handling situation. If you're cleaning up a rodent your cat brought in, do it with gloves and a paper towel and a sealed bag. Do not pick it up with your bare hand. Do not let a young child do it. I want to put one more category on your radar before closing. Hantaviruses in the Eastern Hemisphere, primarily in East Asia and Northern Europe, generally cause a different illness called hemorrhagic fever with renal syndrome, where the kidneys are the primary organ affected rather than the lungs. The case fatality rate is lower. The exposure setting is similar: rodent contact in agricultural and rural environments. American viewers traveling to rural China, Korea, or Scandinavia should know this exists. The prevention measures are identical. Avoid stirring up dust in spaces with rodent activity. Use ventilation, disinfection, and protective equipment. There is one piece of seasonal context worth knowing. American hantavirus cases concentrate in spring and early summer, with a second, smaller bump in fall. The reason is exposure timing. People open up cabins and sheds in April, May, and June after the structures have been closed all winter. The mouse populations have peaked in late winter, and the droppings load is highest then. By the time the structures are aired and used through summer, the contamination has cleared. The fall bump corresponds to hunting season cabin use and to fall cleanup chores. If you live in a state with significant sin nombre circulation, and the highest risk states are New Mexico, Arizona, Colorado, Utah, Washington, Oregon, California, Idaho, Montana, Wyoming, Nevada, and parts of Texas, the calendar matters. April through July is the period when most exposures happen. Pin that to your refrigerator too, alongside the date you last cleaned anything closed up. And one more practical note about the cleaning protocol that I think gets underemphasized. The bleach solution loses potency over time. Mixing a fresh 10% solution before you start the job is meaningfully better than using a bottle that has been sitting in the garage for 6 months. Light, heat, and time degrade the active hypochlorite. The 10-minute version of this: pour a fresh cup of bleach into a clean spray bottle, add 9 cups of water, shake, label it with the date, and use it within 24 hours. After that, dump it and make fresh. That bottle costs about 40 cents to make. Let me give you the closing version of this in fewer words, because the value of this video is the practical translation. If you spend any time around enclosed spaces that have been closed up, and most adults in their 60s and 70s in the United States do, between cabins, sheds, garages, basements, crawl spaces, second homes, and trailers, your hantavirus risk is dominated by one variable: how you clean. Ventilate first. Bleach solution at 10%. Spray. Wait 15 minutes. Wipe with paper towels. Dispose in a sealed bag. Never sweep dry. Never vacuum unless you have HEPA filtration and you know what you are doing. Wear a mask if the infestation is heavy. If despite reasonable precautions, you develop a flu-like illness within 1 to 8 weeks of rodent exposure, communicate the exposure to a clinician on day 1 of symptoms, not on day 5. The clinical evaluation when hantavirus is suspected is fast and inexpensive: a chest X-ray, a complete blood count, hantavirus serology, and supportive monitoring. Early recognition is the entire game. The asymmetry I want you to live with is this: prevention costs almost nothing: a bottle of bleach, an hour of patience, a paper mask. Recognition costs almost nothing: 20 seconds of saying, "I had rodent exposure X weeks ago," to a physician. Late presentation costs everything. The 38% fatality is concentrated in the patients who arrive already in the second phase, with lungs beginning to fail, without the clinician knowing what they were dealing with. A brief note for caregivers: because a meaningful fraction of viewers of this channel are taking care of an older parent who still lives independently in a rural or semi-rural area. The single most useful thing you can do, beyond the conversation about not sweeping or vacuuming dry rodent areas, is to walk through their cabin or shed or garage with them next time you visit and look for active rodent signs. Fresh droppings are dark and somewhat moist. Old droppings are dry and crumble. Greasy rub marks along baseboards and behind appliances indicate active runways. The smell of urine and ammonia in a closed space is a stronger signal than droppings count. If you find any combination of those, get the structure ventilated, get a bleach spray ready, and clean it before your parent decides to do it themselves alone. The single deadliest version of this illness in the case literature is the older adult who tackled a contaminated structure as a weekend chore. If you yourself are a caregiver who has cleaned up rodent contamination at a parent's property in the previous 1 to 8 weeks, the symptom watch list applies to you too. Write down the date of the cleanup. Tell anyone in your household. If you develop fever and deep thigh aches inside that window, the urgent care conversation includes the exposure history. Betsy Arakawa was 65 years old and a working musician. The MV Hondu's passengers were retirees on an expedition cruise. The Four Corners patients over the last 3 decades have been carpenters, hunters, ranchers, weekend cabin owners, parents of teenagers who cleared out attics, daughters who emptied their parents' garages. The illness does not care about the profile, it cares about the dust. I have changed my mind on the right framing of this video twice while writing it. The first version was a contrarian piece on why mainstream coverage of the cruise ship outbreak was overheated. The second version was a deep mechanism dive on why deer mouse in nombre virus has the lethality it has. The version you have just heard is the one that I think serves a 65-year-old viewer most directly. Prevention is straightforward. Recognition is straightforward. The combination prevents almost every death. There is a free resource where I have collected the CDC cleanup checklist, the symptom tracking worksheet, the exposure date log I mentioned earlier, and the exact phrasing for the urgent care conversation, all in one short PDF. The link is in the description below this video. Print it. Keep it with your cleaning supplies. If you are taking care of a parent who still lives independently in a rural area, print one for them. Subscribe if you want the next paper anchor breakdown in your feed when it drops. The algorithm pays disproportionate attention to the small click. That is the entire favor I am asking for. One last thing before I sign off. If this video earned its time, the simplest favor you can do is share it with one person in your life who owns a cabin, a barn, a shed, a second property, or any structure that gets closed up for a season. The prevention behaviors here cost nothing. The recognition phrase, "I had rodent exposure approximately X weeks ago," costs 20 seconds. Most American hantavirus deaths in the published case literature are the deaths of people who never heard either piece of information at a moment when it mattered. You are now the link in that chain for someone in your life. Use it. Read the literature. Then read your body.